Good morning, good afternoon, good evening, depending from where you attend this press conference. My name is Bettina Danowitz. I'm the chair of the Communication Committee of the EFP, the European Federation of Periodontology, and it's a great pleasure to moderate the press conference today. You are very welcome to the EFP press room here in Copenhagen on the event of EuroPerio10, the world-leading congress in periodontology and implantology. As you might know, we are live streaming this press conference on different social media platforms, and also a warm welcome to all people who are joining us from remote locations. I'm absolutely delighted to introduce our spokespeople today. On the left side, the president of the EFP, Andreas Stavropoulos. Then we have the chair of the organizing committee of the EuroPerio10, Phoebus Madianos. David Herrera, he is the scientific chairman of the EuroPerio10, and last but not least, Nicola West. She's the treasurer of this event, but also the EFP Secretary General. Good morning to you as well. We will have a few opening statements before taking your questions. Let me give some aspects for the housekeeping before we start. When you address your questions to our spokespeople, please introduce yourself, state your name, state the country you come from, and the media outlet you work for, and let us know who you are addressing with the questions, if it's possible. If you are joining us online, please ask your question through our chat on YouTube or Facebook. And now I give the floor to the president of the European Federation of Periodontology, Professor Dr. Andreas Stavropoulos from the University of Malmö, Sweden.
Thank you very much, Bettina. A very warm welcome from my side to Copenhagen and to EuroPerio10. What is the EFP? The EFP is an umbrella organization of 37 national societies, and that represents about 16,000 plus periodontists and oral health professionals around the world. It's founded in 1991, so we had this year, or last year, the 30 years anniversary. And what do we really do? We believe, for the first thing, that we are the global benchmark in perio, so in gum health and gum diseases. The main idea or the main mission of EFP is to raise awareness about the importance of gum diseases and gum health. This is what we really try to communicate to the society and, of course, to the politicians, that they can influence the decision making. Among the initiatives that we have to bring that message forward is the Gum Health Day. This is a global day, actually, of awareness on the 12th of May, where we try with our partners and with the national societies to disseminate this important message, and there are different activities in different countries. I guess you'll get some information in the package that you will get afterwards, what exactly is the Gum Health Day. What else do? We do, of course, our main activity is the EuroPerio, that you will see how fantastic of a congress it is, and you will get to hear much more from the other people here in the podium. We also have a more focused, more clinically oriented, smaller size conference, that is the Perio Master Clinic, where we put more clinically oriented topics, a lot of workshops, so it's really for the clinician. EuroPerio has a lot of scientific content in a different level. Then we also have a major activities, the annual workshop in periodontology that's organized by David Herrera. And there we really try to go deep into the science, what is published out there, and try to make synthesis of the newest evidence to try to disseminate that in a concise manner. Part of the workshop is the development of guidelines, treatment guidelines, and that has been now a big job, and that's actually, David, is a fantastic project. We believe with these treatment guidelines we'll have the possibility to influence a lot for the treatment that is performed out there for the benefit of the patient. So that's a major activity of the EFP. Then, of course, we have a scientific journal, the Journal of Clinical Periodontology. That is the highest journal in dentistry, has the highest impact factor, and that's, of course, representing the spirit of the EFP. Then also we try to standardize education, postgraduate education. So we have affiliated programs where we go in and we have some specific guidelines how it should be done. We go and accredit the programs. We we try to do it as standardized as possible, so we know that if you have been part of that program, then you have the basic, very good level. Then, of course, these things, many of these things cannot be done without partners, and we have collaborating industry partners that they sponsor us, and then we also do collaborative projects, and it's mostly, again, disseminating the importance of gum health and the impact of gum diseases on the person, but also on the society. So our vision is, let's say, or our motto is periodontal health for a better life. So we really try to communicate that. And then I have to give the word to you, Phoebus, the chair of EuroPerio.
Thank you very much, Andreas. Very warm welcome from my side. Welcome to EuroPerio10. You heard from our president of the European Federation of Periodontology that EFP was founded in 1991, and about 3 years later, EFP organized their first Congress, EuroPerio10, in Paris. So it has been almost 30 years since the first EuroPerio was organized, and up to now there are only 9, and this is the 10th Congress that has happened. And this is because EuroPerio is probably one of the very few big congresses around the world that is organized every 3 years. And that allows not only for new knowledge to be communicated every time, but of course for the best speakers, scientists, clinicians from all around the world to gather in what we think is the Olympic Games of dental congresses to deliver the presence and future of the science of periodontology and implant dentistry. So this Congress has been growing every time and actually reached the point where not every city in Europe could actually host it. So in order to keep the delegates happy, our colleagues, our industry partners, we have decided to host EuroPerio only in the cities in Europe that have a Congress venue that can actually be able to host it. And we're very happy to be in Copenhagen, that has probably one of the best, if not the best, Congress venues around Europe. So we said before that this is the main event organized by EFP, and the growing success of EuroPerio is mainly due to the scientific program, which of course gives the most recent advances in science and clinic of periodontology and implant dentistry. And this is why this year our scientific chair, Professor David Herrera, and I'm sure he will give you a lot more details on the scientific program. In this year, in EuroPerio10, we have more than 130 top speakers from all around the world and from more than 30 different countries to be with us and deliver, again, the benchmark of what is periodontology and implant dentistry today. Overall, in our Congress, we have more than 70,000 participants from more than 100 countries. And we should not forget that apart from the main scientific program, we have also sponsor sessions. We have 25 of those sponsor sessions. And of course, such an event could not happen without the help of our industry partners. And as you can see, we have a very big exhibition as well, more than 3,000 square meters, where 110 companies participate. And of course, we have also the support of 32 sponsors. A little bit more detail on that you will hear by the treasurer of the Congress, Professor Nicola West. So again, a warm welcome from my side, and I would like to pass now the word to the scientific chair of EuroPerio10, Professor David Herrera.
Thank you, Professor Madianos. I am David Herrera. I'm the scientific chair of EuroPerio10, and which is without doubt the best congress in periodontology in the world. And this can be justified by looking at the magnitude and the scientific program. We have 4 big rooms with a capacity of 4,000, 2,500, 900, and 600 seats. And we will have a program that will run in parallel in these 4 big rooms, the main program, from Wednesday afternoon to Saturday morning. And we will have the best known speakers from all over the world, especially from Europe, and they will present all their latest advances and discoveries. The main program will include 41 sessions. 3 of them are joint sessions, 2 with the international member societies. So we will have speakers from Brazil, Argentina, Taiwan, Lebanon, and another one with the EFP, European Federation of Periodontology alumni. We will have more than 130 speakers from more than 30 countries, as Professor Madianos has explained. But in addition, we will have the Forum for Industry with 25 sessions with 50 speakers. We will have 120 Astra that will be presented as oral communication or oral video communications. 200 will be discussed as posters discussion, and we will have also close to 600 that will be conventional posters. So I should have moved the slide here, and I'm here. And as the program is very busy, we have designed what we call tracks to help the attendees to identify the sessions that will be more attractive for them. So we have tracks for topics, periodontology, implant dentistry, or multidisciplinary. And then we also have tracks for professional profile, being clinician, research, academics, or those interested in hygiene and prevention, such as the dental hygienist. And we also have the Congress app, which will help the attendees to find the place where they want to go, but also to engage with the speakers and the chairs using different tools, of course, the conventional Q&A, but also they can vote or they can take decisions when the speakers are presenting clinical cases. Among the most attractive sessions in the program are the live surgeries, and we will have 3 live surgeries in the Congress. One of them will take place on Friday morning, and it will be a procedure for bone regeneration, which is a critical step whenever a patient is lacking enough bone for the placement of dental implants. And today we have many techniques that will allow for prepare the bone for this dental implant placement, and we will have one of the best known experts performing one of these surgeries from Budapest in Hungary, Dr. István Urban. But probably the main highlight of the program will happen on Thursday morning. We will have 2 live surgeries running in parallel. Those surgeries will try to take care of gingival recessions, which is a problem that, if it happens in the front teeth, has serious aesthetic implications. And many techniques has been developed and proposed to take care of this serious condition. And 2 of the main surgeons who has suggested and are frequently using these techniques will be doing the surgeries in parallel. One will be performing the surgery in Bilbao, in Spain, John Zabalegui, and the other surgery will be performed in Milano, in Italy, Dr. Massimo De Santis. So we will be able to follow the different steps of those surgeries and compare which is the performance of both approaches, and at the end there will be a discussion with all the audience and also the surgeons and the chair of the session, Dr. Otto Thur, trying to understand which is the best technique. But as has been explained before by the President, Dr. Stavropoulos, we also have here different sessions, actually 5 sessions, dealing with the European Federation of Periodontology Clinical Practice Guidelines. These clinical practice guidelines are developed to help the practitioners and the patients to take the best decisions when it comes to the treatment of different conditions. So the EFP the European Federation of Periodontology, has done a huge effort in developing first a clinical practice guideline for the treatment of periodontitis in stages 1 to 3 that was published in 2020. And very recently, actually, today is June 15, it was published June 10th, has been published the clinical practice guideline for the treatment of periodontitis in stage 4. And this is a very important practice guideline because it's not only dealing with periodontology and periodontitis treatment, but these patients with a stage 4 periodontitis will need also multidisciplinary treatment, including orthodontic therapy, dental implants, rehabilitation. So it's a very complicated treatment for the most complex stage of periodontitis, which is periodontitis in stage 4. So we will have one session on the treatment, on presenting the clinical practice guideline on the treatment of stage 4, but we will also have 4 sessions for discussing the implementation of the previous guideline, the one published in 2020 for the treatment of periodontitis in stages 1 to 3. Something which is very important in periodontology is the interaction with other sciences. So we will have different sessions which we call interdisciplinary sessions. So we have sessions that are happening together with other medical specialties, cardiology, endocrinology, neurology, and also with other dental specialties. So we have sessions with endodontics, orthodontics, prosthodontics, or digital dentistry. And in this EuroPerio, we even have 2 sessions working together with marketing science. So that's how periodontology is connected with many other disciplines. And I think EuroPerio10 aims to both improve the knowledge and the competences of the dentist, the periodontist, the dental hygienist, any other health professional to improve oral and gum health in their patients. On one hand, during these 4 days, clinical techniques and treatment approaches will be explained in detail with live surgeries, as we have explained, or in sessions in which many clinical videos will be used. And in addition, different aspects related with prevention, such as the importance of controlling risk factors, smoking, diabetes, or the relevance of behavioral changes will be discussed. And finally, attendees will learn how important gum health is, since poor gum health is associated with important systemic risks, such as cardiovascular diseases, diabetes, respiratory diseases, or Alzheimer's disease. So based on all the things that I have explained, we can say that EuroPerio10 is, without doubt, the best congress in periodontology in the world. And now it is a pleasure for me to introduce the treasurer of EuroPerio10 and also the Secretary General of the European Federation of Periodontology, Professor Nicola West. Hello, Nicola.
Thank you, David. And I extend a warm welcome to all of you. The EFP, the European Federation of Periodontology, has made a step change with regards to sustainability. This is the first time that sustainability has been key in our decision-making for EuroPerios, and it's underpinned EuroPerio10. Let me give you some examples. We have printed 50%, half of the material we did for EP9. We have mitigated CO2 emissions by offsetting speakers' flights and also by giving all our participants a free transport pass around Copenhagen instead of the free backpack. We have sourced food locally. We'll have a map to show people where it is. And we have more recycling, for example, your lanyards, they're PET, and we've decreased the amount of waste we produced. We've also raised awareness by engaging Catherine Richardson, Professor Catherine Richardson, for our keynote speaker. She used to be head of policy climate change in Denmark, and now she's head of sustainability in Copenhagen. And we're in Copenhagen, arguably the greenest city on the planet, which is hoping and aiming to be carbon neutral by 2025. What better place could we have to hold this conference? The EFP Sustainable Manifesto declares that sustainability is far more than just an environmental effect. It affects everyone, everywhere. And we've seen that in the world recently, haven't we, how interchangeable we are with the pandemic. We are committed as the EFP to sustainability. It is a key component for all our main decisions, our strategy, our mission, and for our long-term prosperity. And we ask our national societies, we ask you, the press, we ask industry, our sponsors, to support us, because together we can make a difference. Thank you. I'd also like to thank our followers on social media, online. I pass back to Bettina.
So thank you very much. Thank you very much for your input and presentation. Just for you as an information, we prepared a press kit for you, including the recording of this press conference, graphic material of portraits of all spokespeople, but also about the Congress, and also much more information. And you can access this on the webpage efp.org/EuroPerio. There's all material for you prepared. So we now opening the floor for your questions. So please share your questions in the chat or just raise your hands. And please, for the people here in the room, we need to use the microphone. Otherwise, the people joining online, they won't pick the questions. So please, if you have any questions. And so far, I have a question for all of you. We had some feedback about the live surgeries. And as you said, we have 2 live surgeries running parallel. And this is quite amazing and a lot of effort, especially because they are in different places, in different countries. Can you touch on this briefly a little bit more?
Yeah, of course. Thank you, Bettina. I think it was an idea suggested by Professor Madianos. He wanted to have the 2 surgeries, but not one before the other. He wanted to have them in parallel so the attendee could understand the difference between the approaches. So the objective is the same, is to cover gingival recession. But the way in which you can get that is different, and the different surgeons has been proposing different approaches. So what is going to happen is that they will do each step of the procedure, and we can compare each step. So it will not be, you will not watch both surgeries at the same time. So we will go to Bilbao. We will see how the first step, which is the incision preparation, is done in Bilbao. Then we will move to Milano. We will see the same, and we could compare how different is that, how easy is faster or is easy to perform. And that will be done for all the different steps. So at the end, the result may be the same, so that you can achieve the similar results with both techniques. But the way in which you have done, or both surgeons have done the surgeries, could be easily compared. If you do that the way I was suggesting, actually, which is first one and then the other, first Bilbao and then Milano, then probably you will not be able to understand that good, the comparison or how skillful you need to be in order to do one versus the other technique. I don't know if you want to elaborate a little bit more than that.
No, I don't want to elaborate a lot more. I think it would be extremely enjoyable to actually see it. But I have to say that it's probably a world first surgical debate or a surgical battle happening at the same time. So I think this Congress comes with definitely one of the world first is this live surgical debate.
Mm-hmm. Are you going to share the post-operative results later on, maybe? To see which
in EuroPerio10,
okay.
for sure.
Any questions from the audience? So David, you mentioned the treatment guidelines, and you are one of the leading authors of this publication. Maybe you can explain, or you can tell, or your judgment is how this will improve the treatment of periodontally affected patients, or which impact has this on the treatment of all healthcare professionals? What do you think?
Again, I think the question is very important. It's a little bit in parallel with the Congress, but in the Congress, in the EuroPerio10, we will have sessions on the clinical practice guidelines. But the clinical practice guideline development is a very well-organized process to prepare recommendations for the clinical practice. And this is widely used in medicine, but it's not so frequent that we have used it in dentistry. So having the chance to develop clinical practice guidelines at the European level, I think is a very important step. So once we have the guideline, which is helping all over Europe to use similar recommendations for the management of the patients, we have understood that it's not only for Europe, but every country in the world can actually adapt the guideline that has been developed, following again a very well-regulated and structured procedure. So there are regulations for that to control risk of bias, conflict of interest of the participants. You need to discuss not only with the expert, but also with the stakeholders and the patients. So it's a very well-regulated and very well-controlled process that takes years, but at the end, what you have is a guideline that will align the decisions for, in this case, first all the European countries, and then many countries from all over the world. Actually, Taiwanese Society of Periodontology has adopted the guideline for Taiwan. Many different countries in South America are doing the same. Peru, Ecuador, Argentina, they are doing the adaptation, because once you have the guideline, you need to understand if what is recommended there and the decision-taking process makes sense in your geographical region under the socioeconomic circumstances that you are living. And sometimes there are some recommendations that need to be changed or adapted because cannot be directly applied. But in periodontology, so far, at least for the guideline in the treatment of periodontology in stages 1 to 3, which is the one that has been adapted in many countries in the world, there are no major differences. So most of the recommendations at the end are the same as the ones that were produced at the European level. So yes, I think the impact is at two levels. First, we have a reference for all of us when taking the decision, and that's very important for the practitioners and for the patients. And secondly, the same reference can be used all over the world, and this is something which is happening, and also I think this is good for periodontology at the global level.
Okay, we have one question from, first a question from the audience, please.
Thank you. My name is Dr. Jan Koch from Germany, Die Zahnarztwoche. My question concerns the cooperation between medical disciplines. Has there been any investigation from periodontal societies concerning development of communication between medical disciplines? I suppose not, but maybe I'm wrong. And concerning the aspects, more communication, for example, via electronic email, because this has been improving, and also economic aspects, which is maybe even more difficult to answer, but I'm really curious.
Well, I can start the answer, but all my colleagues in the table are experts in this field also. So I think, for the economic impact of the association of periodontitis with other diseases, cardiovascular diseases, diabetes, there's research available telling us that if you treat periodontitis in a patient with other comorbidities, the medical cost of the other comorbidities can be reduced by 30%. And these are studies mainly produced in the United States, in which the insurance companies, they will both take care of the medical and dental aspects of the patient. So they have been able to say, yeah, if your periodontal health, your gum health is better, then the medical cost of diabetes or cardiovascular diseases can be reduced It depends, but between 20% and 40%. The other question was very interesting, and if you asked me, I think 6 months ago, I would say I don't think so. But I've seen, I haven't read in detail, but I've seen already publications on how to improve the communication between dentists and medical doctors, because that's very important. We are doing that. We have been working, the European Federation of Periodontology has been working with the World Hair Federation or the International Diabetes Association, so that we have communication at the level of the institutional level, but we need to improve the communication at the doctors working together. And that is something that it depends on the country, it's improving, some countries it's a little bit slower, but studies telling us or evaluating different ways of communication, because in the past it was always writing a letter that the patient will bring to the medical doctor, and the medical doctor will broke like this, or maybe it has a fire, we'll use it for the fire. But nowadays it's a little bit different, and what you see is true. I mean, we have electronic means to communicate, and hopefully that will improve. I have seen the papers. I haven't read them in detail, so I cannot give you the information, but there are people analyzing how can we improve the communication between medical doctors and dentists.
If I just may add a couple of things. Professor Herrera mentioned that there are some data coming from the United States, and they're not actually that modest, because there is a study showing that if they would spend money on treating periodontal disease, that would be about $7 billion for a decade. The amount of money that they would save from the other comorbidities would be $70 billion. So, I mean, I think that these numbers are striking, and they really put emphasis on how much gum health can actually impact the overall health. And Professor Herrera mentioned that at EFP level, there has been a lot of work done. We have had several workshops with these global medical societies. But yeah, I mean, on a local level, I think the societies, the national societies, need to promote that communication. And I'm sure in many countries this has been happening. But I'm sure there's a lot more work to be done. And would you like to add something?
Yeah, I would like to say that in the aspect of communication and dissemination, we have also had the Economist article, where it was a special report prepared by the Economist Intelligence Unit, so it came as an Economist issue, discussing this problem and how much the impact it is, and how much impact of peri on the society, also on a fiscal level. And I think that was a very important step. A lot of people have read it, and you get very positive comments. Then the regional differences are, of course, there and very difficult to tackle. And we cannot, as an umbrella organization of professionals, go and dictate to the government what is happening. I can tell you from Scandinavia, where it's my background, that the doctors now know that the mouth is part of the body. So that we have managed to disseminate in Denmark and in Sweden, at least it's quite a lot. And then you have a lot of communication for GPs to the periodontist, where you get patients referred from the GP back to us. It's not ideal, because we would like that is a standard procedure for diabetologists, for example. It doesn't happen, but we're working on it. And of course, I'm sure that it will come there sooner or later.
I forgot to say that we have, in 3 weeks, we will have a workshop, one of these perio workshops that Dr. Stavropoulos was presenting at the beginning, together with the WONCA Europe, which is the largest association of medical family doctors all over the world. We will be meeting with the brand, European brand. And in terms of communication, we have said before that we have worked together with cardiologists, endocrinologists, but those are not the ones who actually take care of most of the patients. So the communication, the most important communication of the dentist probably has to happen with the family doctors, and it will be the first week of July. We will be starting to work with the family doctors and hopefully produce a consensus report in which, among other things, we may analyze how which is the best way to communicate between dentists and family doctors. Sorry, Nicola.
No, I was just going to add, I think you were asking a bit about joined-up thinking and about medical and dental records. I think in China we have joined-up thinking, but in the rest of the world we don't. And we are working, the EFP is working with the AAP, which is our American counterpart in Perio, with an organisation called SNOMED. And we are categorising all the dental conditions so that in the future, hopefully, we will be able to put that together. And I know in the UK, we're hoping to take that on. So when you see a patient's records, the medical and dental records will be categorised and we can start linking things up. But it's taking time, as you can imagine. But it is in progress.
We don't have that in Germany. We don't have this classification for dental diseases in Germany, like in medicine. So this is just maybe some homework to do for Germany.
Indeed. Well, hopefully, if the EFP and the AAP work with SNOMED like this, and we do get that categorisation, it then can be translated to all the different European countries, which would be ideal, wouldn't it? So that then we can look at global disease for so many reasons.
Okay, your statements, I think they answered the question we received via Facebook. So actually, the program of EuroPerio is so great, but you can't be at the same place, or you can't be at two places at the same time. So what can do people, I know you are going to record some of the sessions.
I think this is also a first for EuroPerios, that the 4 main sessions are going to be recorded, live streamed, but also uploaded so that everybody could take a look within the next 3 months on any session that they have missed or any session that they would like to see again. And you're absolutely right, because this has been the main complaint of the EuroPerio delegates all these years, that there's so many good things happening at the same time that nobody can be at so many places at, simultaneously. So this is the first time we are actually doing that, and that will give the chance to everybody who has registered to be able to see the 4 main sessions at their will in the next 3 months. I don't know if you would like to add something.
Well, I was wondering if you cannot be in 4 places at the same time.
I can.
But if the answer is no, then is what Professor Madianos has said. This time you have 3 chances, which is you can watch 1 live and the other 3 at the same time in streaming, and then you can do just that with 2, and then the following day look at the other 2. So for the first time we have that chance, and it's a huge effort to do streaming with 4 rooms, which is what is going to happen during the next 4 days, and then the recorded sessions will be available for at least 3 months for the attendees. So I think it's a huge opportunity. At least you and me will be able to see the recorded sessions.
Exactly. We did it for us, really.
I have a question from YouTube. Periodontics is living good times. Is this Congress a reflection of that? Are we getting more and more important in dentistry?
Well, that's a very good question. I think that periodontology is really coming back at the heart of not only dentistry, but at the heart of medicine as well. We have already heard about the connection between gum health or gum diseases with other systemic disorders, diseases, conditions, but also in terms of dental practice. I think that periodontology is coming back to take the lead role in everyday clinical practice. There has been a period where, a lot of attention was given to dental implants, a little bit overuse of that. But we came to realize that this is not a panacea. This is not something that has solved all the problems of dentistry. And since dental implants come to have problems, then periodontists are coming back handy as well, because they are the ones that know how to maintain teeth. So now they have the role to maintain all these implants that have been placed. But not only that, I think the emphasis of maintaining teeth and being able to save teeth that can be saved, I think this is the major idea here, and I think periodontology has the leading role in saving teeth. So for all these reasons, I think that periodontology is getting really the central core role in dentistry, but also getting, as was mentioned before, the mouth into the body for our medical colleagues, in the heart of the body.
Sorry. One of the posters is about all piercings. What are the impacts of having piercing on lips or tongues? Can you comment on this? David, can you talk about your own experiences?
Okay.
You have to show your
I don't know how could you see it, but okay. No, we know.
It's not in the mouth. Huh? No.
We know for long that the piercings, that they have a problem, especially with trauma. So there's a trauma lesion all over the same place, every day, every minute. So that's the first thing that we see. Of course, also you have kind of microbiological issues, because the piercing will be colonized by bacteria, and those bacteria will be in contact with the tissues, which is not a funny idea, but okay. But coming back to the trauma, what will be presented here in EuroPerio in a poster is a careful analysis of these consequences. So we knew by experience that was happening in our patients, but there was not very serious analysis or very comprehensive analysis. And finally here we will see an analysis that I understand is very comprehensive and will help us, or will help dentists to convince their patients not to place this kind of devices in some very risky areas in which this movement, this repeat trauma over the tissue will create very serious complications that will eventually lead to even tooth loss, so, which is not a funny thing to happen. So, yeah, they're not free of risk, and the approach to place them should be very cautious and understanding all these risks.
Just to add to David's comments, what people tend to do with the piercing on the tongue is flick it over their lower teeth. And they don't think they do it, but they do. And they flick it backwards and forwards over the front incisors. And over time, that jiggling often makes bone loss happen around those teeth, and then those teeth can become loose. I did some research some while ago, and it's quite interesting what people think with the Lambretta and different parts and different materials that these piercings are made from. And people think if they use acrylic and have that as the ball, for example, on the Lambretta, then that won't cause tooth wear. But really, this isn't the case. And I think also, as you touched on, David, it can be really dangerous. Piercing through the tongue. You know, you think of how vascular that organ is, and how much danger there is in piercing through that area. So I think generally it's not well supported in our community, although it's very common.
Yeah, we will also have a press release on this topic, and you will find all the press releases also in our virtual press room on the webpage. So if you have any more questions, please send your requests to our team. You find the link as well on the website. It is efp.org/EuroPerio. So thank you very much for joining our press conference. Thank you very much for your statements. And I wish you a very successful EuroPerio10.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.